Hi, everybody. So, who in the room loves going to see their doctor? Anybody? Show of hands. You're a sick man. Okay, fair enough. He gives you drugs. Who enjoys the experience of sitting in a walk-in clinic waiting room? How is that? Pretty bad, right? So, basically, we started Akira because waiting rooms suck. Booking an appointment for 2 weeks from now to see your family doctor about an issue that you'll talk to him for 2 minutes sucks. And so I'd like to introduce to you Akira. And I'm going to pop to 2 slides here quickly. So what is Akira? Akira is an app you can download where you can press a button, talk to a doctor. And it's literally on demand. So you start by text, you can move to video if you need to. And our mission is to make high-quality healthcare accessible for all of humanity. Okay, now I'll hop to a demo here. So Akira is available for iOS and Android. If you open up the app, if you have iOS, you can actually protect it using Touch ID. This means that if you give your phone to somebody, they can't just go in and see your medical records. This is really important. So we're going to go ahead, and I can see that Dr. Nicholas Riviera is available today. He's the doctor on call. And I'm going to go ahead and talk to Dr. Nick. Now, I'm also going to play Dr. Nick at the same time, which sounds just about right. So I'm going to go ahead and press start a conversation. And if this is the first time that you've ever used Akira, what just happened there? If this is the first time you've ever used Akira, you're going to go through a really quick onboarding process. And this mirrors what you might see if, for example, you went to a clinic and they asked you to fill out a bunch of forms. So we do that really quickly. Information about you, your address, OHIP details if you're covered by OHIP, if you have any conditions, past illnesses, medications, and allergies. Great, we're done. Okay, so we are now going to go and talk to Dr. Nick Riviera. So one of the really cool things that we do, and it should pop up in a second here, is we actually compute a doctor load score. Oh, thanks for mentioning me. That's great. You're screwing up the demo. So we actually compute a doctor load score, and depending on how busy the doctor is, we'll actually deploy a chatbot. And this chatbot basically will sort of buy us a little bit of time and say, hey, can you tell us what you're contacting us about today? And the doctor will get back to you shortly. So I'm going to go ahead and say, oh, there's a debug console. Okay, great. I'm going to say, hey. Okay. And I'm going to attach a photo because, you know what? I want to show that doctor my current anxiety issues standing in front of this big audience. So we're going to go ahead and send the doctor a photo, and hopefully he can help us with that. I'm going to switch over here to the doctor console that we call Zaius. And this is kind of like Slack for doctors. So while I'm messaging with that doctor, essentially what happens is I can go in here and I can see, let's say I message me again. I can see notifications pop up, and I can manage multiple patients at the same time. And the great thing about text is that it's asynchronous. So while you're formulating your response to the doctor can be actually helping somebody else at the same time. We'll get back to that in questions. So basically, you can manage multiple interactions at the same time, and it's kind of like Slack. So as you switch between patients, you can actually see their profile. This is actually designed for a slightly bigger monitor, so it doesn't look great here, but you can see their profile, you can see their medications, you can see their history. And what's really cool, actually, is that every time that you go to see the doctor, they're typically taking notes. So they're taking what are called SOAP notes or clinical notes. And in Akira, I'll just type some garbage. This will be your SOAP note. You actually get full access to every piece of health information that your doctor has. So if we go in here I'll go into My Health. You can see that now I have that note available to me in My Health. And normally this is a paragraph or two about everything that the doctor assessed me for, what I said was wrong, what they think is really wrong, what they recommended to me. And this is fantastic because one of the biggest issues in healthcare is that people forget 40 to 80% of everything that their doctor tells them. With Akira, you have access to every piece of information that your doctor has, and it's synced in real time to your phone. Okay, you also have a full history of any past discussions that you've had with the doctor. And you can not only do text, but if you want to, or if the doctor thinks it's indicated, you can pop into a video call. And the way the doctor does that is they pop into this little menu here, like click be in video call. And as the patient, what you'll see is it'll pop up. I'm going to switch back and forth here 1 sec. All right, you'll see this screen right here. Normally there'll be a face of an actual doctor, not our little bot. You can accept it. And it'll pop you into a video call with the doctor. They can talk to you for a minute or two. They can take notes while they're doing it. They can continue the text conversation at the same time if they need to. And when they're done, they can go ahead and say, you know what, that's great. We're going to wrap up, end the discussion. And just like with Uber, on the patient side, what we do is we ask you for a rating. So every time you talk to the doctor, we get your feedback. And this is something that's really important because we use this feedback and we look at it on a weekly basis to determine how well we're actually serving the patient. Now, when was the last time that your doctor asked you how well he was doing? Has that ever happened? I can't think of a single time. We ask you every single time, and we actually trend that data over time as well. So I'll leave it at that. That's a really quick overview of Akira, and I'll end with just a few things before we go into our questions. So first of all, if you sign up for Akira, go to akira.md, and you can use our Product on Toronto code to get a free month. So I would definitely recommend that everybody go and do that right now, and I can wait. I don't see enough phones out right now. Come on, guys. We want to not have to raise any more money. So if you could just go and sign up, that'd be great. Bit more details about the service. I actually didn't point this out, but the service itself costs $10 a month for unlimited use. So that means as much as you want to text or video chat with your doctor, $10 a month. It's the same cost as Netflix. So if you can afford Netflix, you can afford this. And you can cancel anytime. So if you decide that you no longer want the service, you don't like it, you're sick of paying for it, you can cancel it today. One last thing, we're hiring. You got a 404. Oh, mobile, Matt. Our CTO is sitting back there. If you want to direct your hatred, it's to him. Oh yeah, sorry. I'm gonna go ahead and edit that in real time. So, great. So now you should no longer get a 404. One last thing, we're hiring. So our team is currently 8 people. We're at King and Bathurst, really awesome location. We are hiring for practically everything you could think of. So if you are a mobile developer, if you're a full stack developer, if you are in sales, marketing, please apply. That's it. Thanks.
Great product. Really enjoy the presentation. How does the notion of having a primary care physician fit into your app, and how do notes from here get transmitted back to that person?
Awesome question. So one of the things that we're really concerned about with Akira is something called continuity of care. There's a lot of different types, but we're looking at informational continuity of care. So this does not replace your family doctor. You should still have one. You still need to see a doctor physically. And in our experience, it's typically 25% of the time we have to refer people out to see their family doctor physically. Now, what we do in Akira is if you give us permission, we'll actually copy your doctor on all the notes. And the nice thing about Akira as well is that if you go to see another type of doctor and you're saying, I just talked to this doctor through Akira and they said this, this, and this, you can actually show them the clinical note that the doctor wrote. And rather than just hearsay where you're like, well, the doctor prescribed this for me and therefore you should do the same thing, you can say like, no, this is their assessment in clinical terms. What do you think of that? So either way, you're covered with Akira. Yeah.
You mentioned how much it costs from the patient's side, but what about from the doctor's side? How are they compensated and how many hours do they have to dedicate to Akira versus other patients?
Yeah, so one of the most important things with the doctors is, first of all, that they are comfortable providing this type of care. And that means knowing what they can and can't do. Because obviously this is not an appropriate option for everything. So we actually interview and we screen doctors. And it turns out the doctors that have been most interested in working with us have been a little bit younger, more tech savvy. It's not the case where they're trying to figure out how to use a mouse. We get them to dedicate an entire day at a time. So most family doctors typically work in their clinic 3 or 4 days a week, depending on their patient load. And the other days, it can be 1, 2, 3 days a week. They tend to do something else. So they might work in a hospital, they might work at an executive health clinic, et cetera. And we actually get them to dedicate 1 day a week. Some of them do 2. And we pay them to be there for that day. And that also means that unlike at a walk-in clinic where the doctor is being paid for volume, they're being paid just to be there for that day. And there's no incentive for them to just rush through as many patients as possible. So we actually have text conversations that because someone's at work and they have to like jump in and out of meetings that go on for 2 hours. And that's okay, that's fine. We're okay with that. Yeah. Yep.
Hi, thanks. This is weird. Thanks, yeah. So you spoke about the relationship between the patient and the doctor. Who are your evangelicals? Do you go for the doctors? Do you go for the patients? Do you go for the doctors' associations? How do you go about creating a relationship?
Yeah, so I would say evangelists versus evangelicals. They might object to that. So really, the whole model with Akira, we actually started out by doing Akira as a corporate benefit. And Pivotal was one of the first companies to participate, and they've been awesome to work with. And we'll continue to offer Akira to companies as a benefit. But what we figured out was that the people who were most passionate about Akira, that were most willing to tell 10 people about it, were actually the patients themselves, the people that had some concern and were so pissed off with the state of the healthcare system that they went, this is amazing, this is solving a real pain point for me. And so the whole idea behind our launch, that just happened last week, I don't know if you've seen any of the press coverage, but the whole idea behind the launch to consumers was you can go to the website, you can sign up for Akira, you can start using it right away. And that was the most important thing to us. And we think that patients and you know, people that are passionate about this kind of change are going to be the ones that ultimately drive change.
So question around showing people immediately the notes. Certain things would be the doctor might write a note to remind himself that he doesn't actually believe the patient had, and other similar issues.
It's a great point. And there's a small percentage of the time, and usually it's around mental health, when you have to be a little bit careful about the notes. But this is actually based on a lot of research from a project called Open Notes that came out of the US. And basically the whole idea was, hey, why don't we actually just share the full note with the patient and see what happens? And initially, doctors were like, well, we can't do that. They're neurotic. They're going to Google everything that we said, and they're going to determine that they had cancer, and then they're going to be all over us, and we're going to get sued. But the actual result was that there was no increased anxiety, or very little. Patients felt more engaged. They were more likely to adhere to their treatment plan. And the practitioners actually also felt like the patients were better to deal with. They can actually read it, exactly. They don't have to just forget everything that you said and then misinterpret their memories. So yeah, I mean, there might be some limited set of cases where you don't want the patient to see it. In that case, actually, they would never write something like that. It would just be like, the patient says this, I believe that this is the assessment. And that's okay. They want the patient to read that. Yeah.
Hi. So one of the issues in Ontario that I find is when a startup tries competing with an agency. So one of the situations in Ontario is we have the Ontario Telemedicine Network, which is teleconsult, which they're making their own solution. So in that situation, they have inroads into the government and everything as a single payer. It puts a startup at a disadvantage. Can you help elaborate how you get around that? Are you forced to jump out of Ontario to be able to innovate and actually create a business model?
Yeah, so the way we deal with that is by making a better service. So the thing about OTN is, in order to use OTN, you have to download their platform. Well, it actually used to be the case that you had to physically be at an OTN-approved site and use like one of those room systems. Now, what happens today is they license some technology from Video in the US. They run a couple of video routers in Ontario, and they say, you can use our platform if you want to, but you have to register with them. You have to have a relationship with that doctor already. You have to schedule through that doctor, and they're going to keep the record in whatever piece of crap EMR software they're using. And I guarantee every piece of software in Ontario is a piece of shit. Like the EMR software in Ontario is garbage. And so the nice thing about Akira is you download the app, you press the button, you talk to the doctor, you get the data, and that's it. So we've simplified it, and we hope that eventually, services like OTN and the provincial government really start to support this, because they're putting a lot of money right now into health innovation in Ontario. There's a new office called the Office of the Chief Health Innovation Strategist. And his whole mantra is like, let's build scalable digital health companies here in Ontario. So I really hope they're not talking out of one side of their mouth when they say that. And I do believe that they're trying to do something here. So I'm excited about where that goes.
I think the short answer to that question, OTN will fail. Government fails.
Remember eHealth? Wasn't that great?
Well,
yeah.
So diabetes registry, $40 million later, they had nothing.
Here's a better one, actually. Who knows their vaccination history? Does anyone? Does anyone have the little piece of paper? Okay, you're, yeah, of course. I noticed that, yeah, not many people put their hands up. Yeah, so that's a great case, right? Like, how difficult is it to track whether or not you've had certain vaccinations, and yet it's not done, right? So in a span of under a year with less than $500,000, I feel like we're defeating e-health. So I think that the future just gets brighter from here. Yeah.
Nice positive note. Future will be bright.
Yeah, I think so. Yeah.
Thank you, Dustin.